We are leading into our presentation with Allison Wiens, who is definitely one of those people who is passionate about her work and is here to talk to you today about another theme that we've touched on throughout the conference, navigation and self advocacy. So I am just so pleased to be able to introduce Allison. She is our education and liaison nurse for health equity in the Underserved Populations Program at CancerCare Manitoba. So remember earlier when I directed you all to the Underserved Populations booth that talks about health equity? There's a fabulous video on there, and Allison is the voice on that video. So you might recognize her voice when she starts talking. But she is going to be presenting to us this afternoon on the topic of resources and supports to self navigate and self advocate. So I'll hand it over to Allison now and be back in a bit to field the Q&A, Allison. How does that sound?
That sounds so great. Thank you so much, Cheryl. I am so pleased to be able to talk to you all. I unfortunately can't see you all, but I'm glad to be talking to you all. And I'm hoping that this session is going to feel like quite a good wrap up for everything that you've had the opportunity to hear, and maybe even consolidate some of that information and help you feel like you've got some tools in your toolbox for supporting you and moving forward in whatever stage you're at in your journey or as a caregiver or loved one. So here's my presentation, Taking Charge, Tools and Resources to Help Navigate, Advocate, and Manage. I just want to explain this picture. This is from this fall. It was at a place called Chester Lake in the Kananaskis Provincial Park. And I went for a hike. And this is one of the ways for me, helps me connect with myself and feel the strength within me and really identify my own skills, my own values, and my own priorities, and really connecting to our world and our environment is one of the ways I do that. And you'll see as I talk today that that's a really important part of self-managing and self-advocacy. As I hope you've been able to see, we've all been giving or talking about our commitment to equity. And so, in preparation for this presentation, I've considered health equity, the health equity resource for presenters. But I also want you to know that this is a really important component of reflecting on what it means to provide information to people with cancer and their loved ones, and really stop and consider how topics and content could have good effects or bad effects on people and populations, especially those that are facing oppression or disadvantage or who are being underserved by the system. And I hope today you can see this reflected throughout my presentation. Topics for today. So, we're going to talk about self advocacy, and in there is going to be threaded in components of self management and self navigation. We're going to talk about why this is important. And we're going to give some key resources to support self advocacy, really help folks who want to build these skills to start that path. So, what is self advocacy? Self advocacy is the ability of an individual, in this case with cancer, to overcome challenges in getting their preferences, needs, and values met. Self advocacy is an ongoing process. It begins at the time of cancer diagnosis and even before, and continues through follow up care and after treatment. Individuals who can self advocate make proactive, personally meaningful decisions. They effectively communicate with their healthcare providers and they gain strength through connection to others. These behaviors may actually improve individuals' perceptions of their person centered care, their symptom burden, their quality of life, and their healthcare utilization. So, things like using emergency rooms or having to go to an emergency room. Self advocacy may even reduce the potential for cancer disparities in care and outcomes among individuals who are from marginalized groups or who are experiencing those disadvantages or oppression within our systems. This image, I'm trying to get at really that process of self-advocacy. Again, it's ongoing, and I really hope that everyone here is able to take away that it's learned. So if folks don't feel like they have those skills now, these are skills that we can learn, and it's not skills that we can take one session like this and feel like we know it all. It's really that ongoing process and continual development. There's three domains that were described in some literature, and I've got these sources down below on the bottom right hand side, and I've also included that in the reference list at the end if folks are interested in doing some reading around these domains or these themes in self advocacy. But it really is about these three different kind of spaces or concepts. One is informed decision making. So, the ability to assess health information, recognize opportunities to make decisions, weigh risks and benefits of various options, and make decisions based on your own priorities. It's about finding and applying relevant, trustworthy health information to one's unique situation. And that's really the primary step in self-advocacy or self-advocating. Informed decision making is also about the making decisions about your health and well-being based on your own values and priorities. Another important concept around self advocacy is effective communication with healthcare providers. This is about asking questions, sharing opinions, preferences, discussing personal experiences, and openly communicating concerns. Also, addressing the challenges that you're experiencing. So instead of leaving those challenges to be addressed if they happen to come up, proactively discussing them and communicating them so that they can be addressed. And this is then an opportunity for concerns and discussion to be mutual with healthcare providers. So, negotiation and discussion about treatment decisions, about symptom burden, about priorities and goals. Some common barriers, though, become things like time pressure. This could be time pressure from the provider or patients, and also subtle interpersonal cues from healthcare providers. So I think we can all think of experiences, I certainly can, where I've seen a healthcare provider, they walk in and they say, "Why are you here? What brings you in today?" And you feel like, "Oh, I guess I don't have time to share how I'm feeling." And I hope that again, when we talk today, you can think of some skills to address that. So things like writing your questions down, preparing yourself in advance are some ways to counteract these subtle interpersonal cues that can really derail that feeling of strength and self-advocacy or confidence in self-advocacy. Sometimes also there could be adversarial communication, and this can completely reduce effective communication and impact relationships. And that adversarial communication can come from patients, loved ones, providers, or anyone who's connected within the care journey. And it really does need to be addressed. One of the things I'll mention later on is finding your key allies. So, where you run into these barriers, finding key allies can really keep self advocacy. Keep giving you confidence and strength in self advocacy. And when I showed you that picture before, this third concept is around connected strength, and this is about gaining strength through connection to others and gaining strength through connection to self. So, this can happen when individuals relate to one another. They can talk about each other's experiences, learn from each other, and help each other grow in their journeys. And then intrapersonally or looking within, this is about individuals, thinking about their self perceptions, establishing their self worth and value, and really gaining strength through that connection to yourself. And it's such an important component to having that confidence and these skills in self advocacy. Now I want to talk to you about why equity matters in this space. And we have these top arrows kind of showing you that systems of oppression, social factors, all impact individuals. And all of these things are going to impact your ability to self advocate, self manage, and self navigate during a cancer journey. Systems of oppression are things like racism, ableism, classism, sexism. And these impact social, economic, and environmental conditions and factors surrounding individuals. So things like income, education, access to safe and affordable food and housing, access to transportation and networks of support. And how that impacts the individual in their journey around self advocacy is it can impact access to information. Does somebody actually have the ability to look up information? Do they have that health literacy? Meaning, and health literacy is the degree to which an individual has the capacity to obtain, communicate, and process and understand health information in a way that's meaningful to them so they can make appropriate health decisions. If somebody has not been received an education around their own cancer journey or information about their own cancer journey to understand the content that they're being provided, it can make it extremely challenging to be able to make decisions about their own health. And part of self advocacy is also then developing those skills to be able to say, hey, I didn't understand the way that you said that, and I need you to speak to about it in a different way. These are my needs, and this is the way I need to receive information so it's meaningful to me. That could be in a different language or in a language other than English, or it could be in more simplified terms, thinking about medical jargon, which even I, after being an oncology nurse for over 15 years, I find it very confusing to still hear all this medical jargon. Self advocacy has, this is where we're going to talk about these skills that you can develop, and I'm going to give you some tools. Um, One of the ways you can build your own capacities to self advocate is to learn about your rights and responsibilities as a patient, to write down and keep track of your own cancer journey, to write down your questions, to assess the information that you are being given or that you're searching for and determine if it is useful and reliable. Ask questions. Keep those questions coming. It's important that your questions are answered. Your questions are important for your own ability to make decisions. Another key skill is to take control or share decision making. And I'm going to talk about a few of these soon. Keep this next one in mind. Speak up. So when you feel like you are not being heard, sometimes even if it you don't have the right words, the literature says if you can speak up with simple words saying I don't understand, or even stop, I need you to do this for me. Or if you're not sure what you need, just say, stop. I don't know what I need right now, and I need a moment. Um, Also, the ability to discuss information you find online with your providers is really key to that ability to decision make and feel like you're appropriately informed. And then lastly, and I mentioned this earlier, find your allies. Find your key allies. So your rights, as I said, I'm going to go through a few of these little skill sets. So your rights, you have the right to make your own decisions about your health. These are actually established rights through Shared Health Manitoba and the province of Manitoba, our health ministry. So these can be found at this link here. If you look up Learner's Guide Case 2, or you look up Shared Health, Learn Your Rights, you will be able to access resources in telling you what your rights as a patient are. You also have the right to expect privacy and dignity. You have the right to be informed about experience and training of the clinicians who are caring for you. And you have the right to be informed before any consent to any procedure. And you really should have all of the information you need in a way that is meaningful to you to be able to make that decision. You also have the right to access your personal information. And you have the right to ask for more support or other opinions. So, this could mean asking for the support of a patient advocate, a patient representative, or asking for support from a psychosocial oncology clinician, or even for some people who have looked at some of those resources around knowing your rights, you have the right to write letters to our government if you have concerns about our health system. Um, Now we'll dig in a little bit to decision making. There are things called aids, which are wonderful, and patient decision making aids help to improve understanding of treatment options and patient values and preferences. They serve as platforms for expressing concerns, obtaining support, and having meaningful conversations with healthcare providers. And they facilitate active personal and family engagement in decision making. They enable the recall of information and evaluation and of satisfaction and decisions. And they also can help present the healthcare team with structural barriers where there's things in the way for your care or your ability to make the decisions that you need to make around your healthcare. Shared decision making refers to the process that patients and their chosen caregivers and providers work together to make fully informed treatment decisions using the best available evidence and considering the patient's or your values and preferences. Now, I want to talk quickly about finding reliable information. This is so important in an age where we all have information at our fingertips, and accessing useful, accurate, reliable information is an important part of improving your decision making, your self-management, and your personal strength and confidence. When you have the information you need, you can move through the system much easier. But when you don't, and you're being misinformed, or even finding information that can be harmful, it can disrupt care decisions and delivery. It can have a negative impact on the relationship with the care team, and it can also have a result of increased risk of death. So between 2018 and 2019, there was a review that looked at social media, and nearly one third of popular social media cancer articles contained misinformation or harmful information. The review that was conducted showed that cancer information on social media is often inconsistent with expert opinion or what we have found with using the scientific process to answer questions. Patients and loved ones may also then experience confusion and discomfort when trying to determine the reliability of online information and to help them with making decisions. So misinformation in your health is really critical. And, overwhelmingly, the majority of people in Canada, almost 90%, use smartphones in their daily lives, and including to access information like your health information. So I want to offer you a checklist. And if anyone has a phone out, please feel free to take a screenshot. Here's a checklist that I've pulled from a few different sources online. um, Check when you're reading information who runs the website, or what is the source of information, who is writing the information, and who is funding it. So this is critical when people are actually being paid to write that information. Also, how current is the information, and is there an original source? What does that original source say? Check what they say their sources are. Sometimes those sources actually don't match, or what they're quoting from those sources is not actually found within those sources. And when you can find those critical allies in your journey, ask your healthcare provider. Reliable patient resources are resources like CancerCare Manitoba, non-for-profit Canadian Cancer Society, or American Society of Clinical Oncology, National Comprehensive Cancer Network, National Coalition for cancer survivorship, and cancer associations by disease site like the Lung Cancer Canada or Breast Cancer Canada. And this information is curated and ensured that reliable evidence based information is being shared. Now, I want to show you some really good resources that exist. For anyone who hasn't had a chance to look on the CancerCare website, there's a plethora or a multitude of resources that we have around, helping you along your journey and also helping with along the treatment trajectory. I hope that you were able to attend the talk on Nuna, but Nuna is a platform that we can use to help with communicating. And you can send messages to your care team, view your appointments, receive messages, and there'll be more functionality from Nuna as the years go by. If you're someone who loves paper, we still have My Cancer notebooks, or we still have notebooks or tools within Cancer Care that are paper based to help organize and record. And the My Cancer notebook through Cancer Care Manitoba, it shares key cancer specific resources. It's a notebook for treatment planning and tracking. It can be used as a symptom tracker, an appointment tracker. It helps you think through goals and priorities. And it also has special reminders to think about the specific needs you might have to improve your journey. We have a similar patient guide, First Nations patient guide, and we continue to adapt patient guides for underserved populations by our system. There is a cancer journey pathway document to help people understand generally what the journey looks like and guide you to key resources like cancer navigation services and psychosocial oncology, as well as WRHA Indigenous Health, which, if anybody had the chance to hear Elder Kathy Bird, she had mentioned this resource to connect to traditional healing. There's a page about managing symptoms and side effects, and it includes videos and audio recordings as well as printouts and some resources specific to decision making and support tools and supports. If you go to this website again, feel free to take a screenshot. If you There is a decision aid that was created here in Canada at the Ottawa Hospital, and it helps you or a family member or loved one or caregiver work through important decisions. And you can present this to your healthcare providers when you're trying to talk about the decisions you're trying to make and ensure that your voice is being heard. Another really good decision making tool, and also a tool to help with thinking through your own care needs and goals and priorities, is the Coming Full Circle resource for planning your care. And this resource was created in partnership with Indigenous elders and healthcare providers. And although created for Indigenous people, the resource, I would say, is superior and could be used for every individual. When we look at some of the key self advocacy skill building tools out there and toolkits, there is a cancer survival toolbox through the National Coalition for Cancer Survivorship. And there are actually little webinars and audio files. You can listen to it as a podcast to help you work through skill building around self advocacy. This toolkit through Advocacy Focus in the UK is absolutely amazing. It has webinars, it has a printout, and it was created in partnership with people living with disabilities. So, for really considering those people who are experiencing inequities and their specific needs to enhance their skills in self advocacy. So, my take home messages today are that self advocacy can improve communication, experience, and symptoms. It's an ongoing process. It absolutely can be learned, and equity matters. When you can, and you're finding that inequity is getting in the way of your journey, find your key allies. These could be folks like psychosocial oncology clinicians, nurse navigators, someone like myself, or folks within other parts of your care team. Thank you so much. I hope we have some time for questions now.
Allison will just beam over right to the questions that are starting to pile up for you. Um, is it better, do you think, to use Nuna to ask questions or wait until you meet your doctor?
What a great question. And the reality is, I think it depends on the type of question you have. So, if it's a question that you feel can wait, I think waiting until a scheduled appointment makes sense. But if it's a question related to symptom burden or distress, or you're feeling like you need more urgent support, Nuna could be one option. But also connecting directly, with the old school telephone and calling the clinic team, even though that typically means leaving a message. It's important that that information is conveyed in a really timely way, rather than waiting for an appointment. Again, especially when you may be experiencing symptom changes, or you're concerned about something along your cancer treatment plan. I hope that that helps.
Oh, thank you so much for that insight, Allison. Next one, which is absolutely for you and what you do for our patients. Are rural patients considered underserved? Information for rural patients is under the served populations booth. So maybe you can speak to that.
Yes. And, the truth is yes and no. Not everybody who lives in a rural setting will feel that they're underserved. The reality is, when we talk about the word underserved, we're talking about the health system functioning differently for some than others. So the reality for all rural patients is to access health services that looks different than somebody in an urban setting. However, those social, economic, and environmental factors, or the conditions around a person, really come into play. So if somebody is living in poverty, if they live in the city, they may be experiencing much more disparities or oppression or issues with access than somebody who lives rurally. So yes, because we have to plan for underserved populations who aren't getting we want to make sure that as we're planning services, rural populations are considered to ensure that the resources are provided equitably. But it doesn't mean that an individual is underserved. We're looking at it more at a population level.
Super insightful, Allison, and some kudos about your great lists of resources and plans to check them out. Another question: how do we expand services for people who don't have private insurance? Hmm.
That's a good question, and it really comes down to what the services that are being sought. So when we when we have services that are critical for care provision, those are the services that we really need to identify as underserving people, which could lead to differences in their health outcomes. And if private insurance for some means that some people can access something, let's say like lymphedema therapy, then we need to build things within our system so that folks can access resources like lymphedema therapy. Um, when we come back to those advocacy skills and we think about connectedness, this is also an opportunity where people are identifying where their needs have not been met. If they have the space or capacity to advocate and connect beyond the intrapersonal setting, but expand throughout our health system and advocate, or maybe get involved as a patient and family advisor, then we can start identifying where those issues are coming up. We don't know necessarily about all issues unless they're being spoken and said to us. And we really need to also prioritize where we can ensure that that when we make changes to our system, we're actually serving the people that it needs to serve. So great
Absolutely.
question. I also just want to say that if you connect to psychosocial oncology clinicians and key advocacy groups, even within your regional health authorities or within our own organizations, they often have some knowledge of some key connections or some key resources that exist kind of to address these gaps that are there, like where private insurance leaves some people not covered.
Yeah. Oh, for sure. And Allison, I think we have just enough time for our final two questions of the session. A quick one: how do we get the Cancer Notebook paper version? This would really help my fiance and mom on her journey, and I'm good with non-paper for his journey. So different ways, I guess, of
Okay.
learning. Yeah.
Thank you for that question. And if you're able to go to the Cancer Care Manitoba webpage and you look at planning your visit, so right, actually, the image that you saw that I took the screenshot of was exactly that spot. When you hover over patient and family, the very first selection is planning your visit. When you select that, it goes down to those resources. So there's the cancer handout and the cancer notebook. And right underneath there, it says to request a paper notebook, and then you can connect to that email or phone number, and they can send out a paper notebook. That's a really good question.
Yeah, that makes it easy
We do
peasy.
have them on site too. If you're on site, you can also go to the Patient and Family Resource Center, and they would be able to access that for you.
Great. And Allison, ooh, last question, but it's a good one. I had to connect all of my helpers to improve communication between cancer care staff and my own private resources. How do we expand access to these resources for people in the North and rural and underserved populations?
Oh, that is such a good
Mm,
question. This is where Cancer Care Manitoba prioritizes patient voices in the way that we plan uh, development of resources or new initiatives. And when we have patients and families and caregivers who are involved in the Patient and Family Advisor Program, we can hear those voices, then we can again identify those needs. And so the Underserved Populations Program actually works in partnership with several groups in the North to where we're identifying not only with patients and family advisors, but also with community members to identify how to support people in the north of Manitoba. And we're undergoing a lot of that work now with our Indigenous partners to try and identify how do we fill those gaps? What actions can we take to fill those gaps and ensure that people have the resources that they need and that they're connected to those resources properly. And then the downstream effect of that too is we have these partnerships is those voices impact the ongoing work we do. So if we're hearing from patient and loved one voices saying we need our providers to connect in this way, well, then, as we move forward with ongoing initiatives and work at CancerCare Manitoba to improve patient experience and to improve the relationship healthcare providers have with their patients and their loved ones, then we can incorporate that and incorporate people who have a passion in that area into the work that we do. So, I hope for anybody on the call who's interested in patient and family advisory that you might consider it, and also on our webpage, there's spots to provide feedback, and I can't tell you enough how important that is. When your feedback goes to the email about, how was your journey, how did it go, good or bad, we do that does matter. We do hear that, and we do react to it. So if you have something to say, that email on our website saying tell us, about your experience, it does actually get read.
oh my goodness. So much good work, right, Allison, that's going on behind the scenes. And we do rely on patient feedback as well to further develop our programming. Allison, thank you so much for your information and time. And yes, thank you